Implants in the dental field have emerged as a common method of replacing damaged or missing teeth. It involves the surgical placement of implants made of titanium in the jawbone to hold a bridge or replacement tooth. It's a lengthy process that needs careful plan and execution by an experienced oral surgeon. The video below will examine what to expect prior as well as during and after surgical treatment for a dental implant. Before surgery. Prior to having dental implant surgery, there are many procedures to follow in order to ensure the success of the procedure. A thorough examination of the oral health condition of the patient is required. The most common method is X-rays and 3D scanning to determine the state of the jawbone, as well as its adjacent teeth. If the jawbone isn't sufficiently strong to support an implant for dental purposes, then a bone graft might be needed to boost the bone's strength. It can take several months before healing is complete. Surgical procedure can begin. If the jawbone has been prepared, then the next thing to do is to formulate a treatment plan together with an oral surgeon. The treatment plan will include the required number of implants as well as the exact location of implants, as well as the type of dental restoration that will be applied. Patients will also be given an opportunity to discuss any questions and address any concerns they may have concerning the procedure. During surgery. On the day of operation, the patient is going to receive an local anesthetic in order to reduce the region that the implant will be implanted. In certain instances, the use of sedation is used to aid the patient in relaxing through the procedure. The dentist will create an incision through the gums to expose the jawbone. A tiny cut is made into the bone. Then, the titanium rod is inserted safely into the jawbone. The gum tissue is sewn shut, then the healing process starts. The procedure generally will take between 1 and 2 hours per implant, contingent on the nature of the particular case. Patients can usually return to work or usual routine on the day following. However, it's important that you follow the postoperative guidelines that are provided by the surgeon to ensure that the healing process is properly. After surgery. Following surgery, it is common to be afflicted with some swelling, discomfort, and bruises within the first few days after the surgery. The surgeon of the oral cavity may prescribe anti-inflammatory medication or other antibiotics to ease any inflammation or pain. It is crucial to stick to moderate diets for the first couple of days following the procedure to ensure that you do not put tension on the implants. Also, it is advised to stay away from smoking as it may hinder the healing process as well as increase the likelihood of complications. Within the next few months, they will join with the jawbone in the process of the osseointegration. This happens when bone is fused to the titanium posts, resulting in the foundation that is strong and solid to support the tooth replacement or bridge. When the osseointegration process has been finished, the final replacement may be positioned over the implants. It can be a bridge, crown, or denture, dependent on the quantity of missing teeth as well as the specific needs of the patient. Dental implant surgery is an intricate procedure that requires careful plan and execution. When they know what can be expected in the lead up to, during, and after the procedure, patients will be more relaxed and comfortable about their choice to have dental implant surgery. When properly taken care of and monitored implant surgery, they can offer a durable and natural-looking solution for damaged or missing teeth.